Welcome to Facial Plastics Fridays. It's Dr. Brace here, and I'm going to continue on the eye or periocular topic that we've been talking about with brows and blephs, and talk about what is it that makes an eye look youthful, makes an eye look beautiful. There's not really a one kind of standard answer for this, but there are some general features or general rules around the eye that make an eye look rested, make an eye look youthful, make an eye look pretty. And one of those things is the skin. And so if we start from the outside and look at the skin, youthful eyes have a really smooth lower eyelid, and the transition from the eyelid to the cheek is smooth. And what we see with aging is, as we age, the mid-face starts to come down and in, and that leaves a hollow here that we sometimes call the tear trough or the nasal jugal groove, and a hollow out here or the orbital malar groove. That's where some ligaments and tendons attach and don't allow things to drop. But the fat of the face that cushions the face drops down, and then you get this kind of double curve where you've got a little bulge in the eyelid because some of the fat in the eyelid starts to pooch out. You have this hollow here, and then you have another bulge because the fat has fallen down. So a youthful eye would not have any of that. A youthful eye would have a smooth transition from the cheek to the eyelid. The skin would be without sun damage, so without brown spots, without little red vessels, without xanthelasma or little cholesterol deposits. It would look smooth. It would be without wrinkles. It'd be without etched in lines. For the upper lid, similarly, everyone's upper lid's different depending on the depth of their eye socket. So I have very deep eyes. You don't see a lot of my upper eyelids, never have been able to, and other people have shallower eye sockets and you can see more of their upper eyelid. But what makes an upper eyelid look youthful really is if it's framed well. So similarly, like we want volume all around the lower eyelid, we want volume around the upper eyelid. You don't want to have a hollowed out sulcus above your eye. You don't want that A-frame deformity. You don't want excess or extra skin hanging down onto your lash line. So smooth, tight skin with good volume around the eye is really what makes an eye look beautiful. And you talk about the brows like we've talked about in the past. If the brow is heavy and low, yes, it will add volume, but it'll add too much volume and it'll be sagging and you won't be able to see the eyelid. And so you want the volume of the eyebrow to be up so that you can see the eyelid so it looks bright and it looks awake. And so how do we achieve that in someone with an aging face that has experienced some or all of these changes? For volume, for the lower lid, what I like to do is something called a transconjunctival lower lid blepharoplasty, where we're moving the fat from the eyelid down into the cheek, and then we're using that fat as volume in this area. The thing about the volume in the eyelid or the fat in the eyelid is that it doesn't really transpose well to the outer eyelid, and so for that and for the lower cheek, I like doing fat grafting. So we take some fat from the abdomen and we transplant it or transpose it up into the cheek here, and we add that volume back so that you create this beautiful lid cheek junction, this cheek mound that adds volume and frames the lower eyelid. For the upper lid, like we've talked about, a skin pinch blepharoplasty to remove the skin, possibly a fat transposition to move the fat or to reduce some of the fat, and sometimes fat grafting where someone's really hollow to add volume back in to get rid of an A-frame deformity or a big sulcus can really help frame the eye and create a beautiful natural result. And if they need a brow lift, it's usually a temporal brow lift to lift up the tail of the brow. Once you've done all of that, you've restored the volume, you've restored position of the brow, you've made the skin tight. I love CO2 laser as a resurfacing tool to tighten the skin further, to remove any surface irregularities, and to just make the tone and texture really smooth. So that's the usual recipe. If somebody wants to address their eyelids and make them pop, it's a brow lift, it's an upper lid blepharoplasty, and a lower lid scarless transconjunctival blepharoplasty to move fat down into the cheek, to fat graft around it, and CO2 laser to finish it off, and that creates a really beautiful eyelid. You want to be careful with sun precautions if you do go through all of that because you want to protect that investment, so sunblock is really important. Eye serums afterwards are really important. We usually do some pulse dye laser treatments afterwards for redness to get that to fade away. But if you go through something like that and you do all the post-op care, you really will have a rejuvenated eyelid that stands the test of time and looks really natural and really beautiful. Hope that answers the questions. Everybody have a great weekend.